Okay, the first thing to do is to make sure that when baby goes to the breast and latches on, that the baby is feeding comfortably, and as your milk supply develops over the first few days, that baby is actually transferring milk out. The best signs to tell you that your baby is getting enough milk is have a look at the nappies. From the first week of age, a baby should be having at least 6 or more heavy wet nappies and at least 3 or more dirty nappies. There'll be a mustardy yellow, seedy consistency, and this should continue on a daily basis for at least the first 6 weeks. So remember, at least 6 heavy wet nappies and at least 3 dirty nappies from the first week of life right through until week 6 is a great indication that baby is doing well. Remember, if the baby's taking enough milk in, it'll be putting the nappy out the other end. So another indication would be weight gain. It's normal for babies to lose a little bit of weight in the first few days after delivery, particularly when they're breastfeeding, because the baby is only taking very small amounts of colostrum initially from the breast until the milk supply begins to develop. So most babies on average will lose somewhere between 5 and 8% of their birth weight, which is normal. We allow for it and we don't worry about it. So anything above this would be an indication that baby may not be getting enough milk. So weight loss, the baby should, as soon as the milk supply starts coming through in the breasts, the baby should stop losing weight and should slowly start putting it back on. Majority of babies, if they're breastfeeding well, will regain their birth weight within the first week, but we generally allow up to 2 weeks. So this would correspond with around the time you'll be due to see your GP. So by the 2-week GP visit, baby's weight gain baby should be back to its birth weight and should steadily be putting on weight. On average, most babies will put up somewhere between 4 and 8 ounces on a weekly basis after that. So that, together with all the wet and dirty nappies, every breastfeed should be comfortable. You should see baby settling between feeds at this stage and cueing then, waking regularly every 2 to 3 hours to feed and then settling after the feed. And often it's just the little things like wearing a newborn baby grow for the first 2 or 3 weeks, and then all of a sudden you feel, oh, baby's getting too big for this, needing to move on to the next size. You should nearly visibly feel the extra weight in your arms on a daily basis, and you'll know that your baby is beginning to, it's more settled, it's more content, you're used to your baby's ways. Generally from about 3 weeks, then baby will start to take a little bit more notice. So these are all positive signs that the feeding is going well. Absolutely, we practice rooming in here in the hospital, which means your baby is in the cot beside your bedside throughout your stay. The reason why we have babies in clear cots beside you is to allow you the opportunity to get to know your baby, to get to know their cues, that you can feed them whenever they want to feed, if they need to be winded or changed. You get used to having your baby beside you all the time. The only time your baby should be separated from you is if the baby becomes compromised or ill and has to be transferred to the neonatal intensive care unit. But for the rest of the time we practice rooming in, baby should be with you. Okay, to avoid sore nipples, the most important thing with breastfeeding is get the positioning and attachment right from the beginning. So that means getting a good latch, a good deep latch. If a baby has a shallow latch and is only sucking on the nipple, then the nipples are going to get sore. Remember, baby is breastfeeding, not nipple feeding. So we want the baby, every time it goes to the breast, to have a big wide open mouth, and we want the breast to be directed right back towards the roof of the baby's mouth. So a good deep latch should ensure that the nipples don't get sore. Okay. Again, this is on an individual basis. You have to look at what's going on within the 24-hour situation. But initially, I would expect most breastfeeding babies to feed any time, could be any time from 8 to 14 times in a 24-hour clock. So on average, most of them will feed maybe 11, 12 times. So that's at least every 2 to 3 hours. Babies, when they go to the breast, take small amounts of colostrum initially, and then the supply builds with every feed. So as the milk supply begins to be established on day 2 to day 5, baby gets more and more volume of milk on it, and colostrum. Remember, the colostrum is still going to be there for the first few weeks mixed in with the milk. So baby gets more and more with every feed. So depending on the length of the feed, The other thing you're depending on, as your breasts start to get heavier with milk, does the breast change during the feed? So the quality of the feed. When the baby goes to the breast and it takes milk out, is the breast visibly getting softer? Can you feel a difference in the weight of the breast? Does it feel softer and more comfortable after a feed? Because that's a good indication that there's good transfer of milk. So you have to look at every feed and see, is the baby latching well? Is the baby transferring the milk? And this will determine the length and the frequency of feeds. The longer the baby feeds and the more milk the transfers, the longer the baby might settle and take to digest the milk, so it might be a longer period between feeds. Whereas some babies like to snack and they might only have 10-15 minute feeds, but in an hour and a half they want to go again. So it depends on the quality of each feed. Absolutely. It's part of our role as healthcare professionals to ensure that when you go home, you know how to safely and confidently feed your baby, regardless of your choice of infant feeding. So if you need a demonstration, this can be done at ward level, but certainly the ward staff will go through how to make up bottles and make sure you feel totally confident going home. And remember, when you're making up bottles, you also need to know about cleaning your equipment and sterilising it for every feed as well.